Nebo Kericho Committee netononjin en ICT en bunge nebo Senate ase kokerchigei boisietab muswoknotetab kasari en kayumetab aisurut. Kabinet kasarta nekokonde tetutik county inotok chebo koker kole koityi target nebo silingishek milionishek 600 en kayumetab aisurut en kenyitab chepkondok nebo kenyitab 2026-2027. Ingenyorun sirindet nebo logoiwek en county nebo Kericho Winnie Towed.
Kondochin seneta nebo Nandi Samson Cherargei ak nebo Kwale Isa Juma ko kachikil ichek boisietab muswoknotetab kasari en kayumetab aisurut ak boisionik alak en kebeberwek cheterter en county niton cheboto assembly ak sipitalitab county referral.
We are here on the issue of all source revenue. We wanted to see how IT is working in the county government of Kericho. We start in the department with the finance and ICT led by Waziri Rob, and our counterpart can teach another heads of departments. We were able to discuss the issue of revenue collection. We wanted to know their revenue potential, which CRA has put it to 2 billion, but the county itself has put it at 700 billion. They are saying the revenue will spike, especially during these months because of renewal of business permits among other revenue streams. We have noted that they need to still do a lot. They have assured us that in the next coming months, they will onboard all the revenue systems to allow the efficiency in all source revenue. The reason we are here in the hospital is to see how the revenue systems of the hospitals are working, how the billing system is being done, diagnosis, drug dispensation, and because it's not connected to the other part, we would have finished in the other side, but we wanted to see from the ground. We have seen there is also the issue of pay bill numbers, and that is why we are here, the issue of pay bill numbers. We are here to check on how IT is working in this hospital.
Kailo Senator Cherargei boisietab tugetab konyoiset nebo SHA en sipitali niton.
We want to ask the county and the both Waziri are here and the leadership to ensure that we improve on efficiency in terms of drug provision, in terms of medical services, so that our people see value. You know, when we give money in Nairobi, we want to see the value of that money. But I'm happy that SHA is working. Very true. And contrary to the propaganda by people who don't use SHA and the politicians and the people telling us SHA is working, we have experienced. We have seen patients being discharged. For example, this level 5, they are paying up to 3,920 per patient. So per day, if you stay, I saw a patient who stayed 5 days, the SHA cleared the entire bill. They are allowed to go home. So SHA is working. I want to encourage the people of Kericho and Kenya to register with SHA. Our only concern, which we have noticed, and we'll take it up with the Ministry of Health, is that the rejected claims are very high, and we have seen some of the reasons for rejected are not sufficient, because if they have seen an issue where they have said the reason they rejected the SHA claim is because of a birth certificate, but they have been attached.
En kasaratan ko karutechi ichek kipsomaninik somok kobun sukulitab barak nebo Kabianga chetesetai konyoru konyoiset en sipitali niton bo Kericho referral, che alak en 39 chekokimut konyor konyoiset en betutab amut kosubkei ak chiletabgei nekobit yekon kobutok kebebertab kot nesomanen icheket.
I want to thank the hospital because yesterday there were more than 39 injured students that came from Kabianga University, and I'm happy the medsup, Dr. Langat, has confirmed to us that almost all of them has been discharged except the 2 that had encountered soft tissue injury. The other 2 got fractures, and the hospital has assured us that they are going to give them the best medical care until they recuperate and go back to their studies, and that is why we hope, and I want to appeal from here Kericho, that I want to call upon the Ministry of Roads, Transport and Public Works to go to Kabianga University and do proper audit of the building. We were scared as a country when we heard that there was an accident where parts of the building was collapsing, and I think that building and the Kabianga University, the Ministry of Education, the Public Works, Roads and Transport and Public Health must and should condemn that building and not be used by any students until it is cleared by all public works actors, so that we don't need to have these injuries that we saw today or the last 2 days. I can imagine the pain, the anguish of the parents and the guardians when they heard that accident had happened in Kabianga. So after visiting the issue of IT departments in this hospital, we thought that we should visit the injured students, and also we have seen a number of patients. We have seen that, and we hope in future, and it is our prayer that the Londiani South Rift Hospital should be actualized, because we can see the hospital is struggling with capacity. The hospital is struggling with infrastructure. You have to note most of these infrastructures were done immediately or before independence, and they still lack a lot of buildings. But I want to hope, and we are happy that the president has given a note that we will do a referral hospital in Kericho County, so that it can ease pressure on this Kericho County referral hospital here in town. And I hope that one can be moved very fast, so that our people can access medical care, because you have to appreciate all the referrals are being taken to either Moi Teaching and Referral Hospital in Eldoret, which is almost 2 to 3 hours drive from here, or Kenyatta National Hospital, or now we are lucky we have Kisumu Jaramogi Oginga Odinga Referral Hospital in Kisumu. So we want also Kericho and South Rift to have their own referral hospital to ensure that they are able to do most of the treatment.
Tesetai kipsomaninik somoku konyoru konyoiset en sipitalitab County Referral nebo Kericho chebo sukulitab barak nebo University nebo Kabianga, kosipkei nekokimut kipsomaninik 39 konyor konyoiset en sipitaliniton yekongobit kamuiset akorwai kipsomaninik yekongong'esiogen kebeberta nebo kilasit nekosomonen icheket. Akot kounoton kokokitiakta alak 36 yekongonyor konyoiset, ako tesetai somoku choton konyoru konyoiset en sipitaliniton. En logoiwekab emet chebo Sai TV kobun county nebo Kericho, kainenyun ko Winnie